Hey guys, Dr. K here, back with another YouTube video, and this one is really special to me because I'm going to talk to you guys about all the ways that being a locums physician has helped me in my career as a young doctor. And by the end of this video, I'll have you convinced that you should do locums work too. Hi, if you're new here, my name is Dr. K. I'm a locums tenens physician, and I have a year of experience as a locums physician. It's the first job I took out of residency, and I am not going back. Oh, and if you don't already, follow me on social media at Dr. KAYDO on all socials. To give you a backstory, I started locums work right out of residency, and it was probably the scariest thing I ever did. It felt scary to know that I wasn't going to sign a 2 to 3 year contract, join a practice, and have the so-called job security that I think most people look for when they finish residency. Instead, I chose a life where I could have more flexibility and ownership of my time, and a life that helped me feel more fairly compensated as a physician. For me, I knew that I wanted to work local locums, which means that I wasn't wanting to travel after a really stressful residency, and I wanted to keep some normalcy in my life. And I found a gig that was about 30 minutes from my place, and it really worked out. When I first started my job, I worked with another locums physician, and he had more experience than me, and I really was able to learn and grow from him. He was able to work multiple jobs after being out of residency for almost 10 years, and didn't have any difficulty finding jobs and locations as he was moving around, and was able to experiment with different styles, whether it was outpatient, urgent care, or hospital settings. And I think that was a huge blessing for me as a new doctor who was doing locums, was to connect with another physician who was doing this. It's always really scary until you see somebody else do it and love what they're doing. And this is part of why I want to be in this space, and make sure that other doctors know that it's important to think outside the box when it comes to medicine. It's not black and white. Our opportunities are not black and white. And so much of the job search and the options that we have as physicians isn't really taught to us in training. One of the things that I felt like would be a burnout for me in my specialty of family medicine was the administrative tasks and the paperwork and the charting, and I knew that I wanted to tackle this head on. I wanted to prevent the burnout before it happened. And let me actually explain to you how being a locums doctor has helped me fight this burnout. One, I'm way more efficient because I have a max cap of hours I can have with my agency per week as a full-time physician with this clinic. And so for that reason, I'm a lot more efficient with the time that I do have. And number two, I actually get to bill the hours that I am doing those tasks in my allotted time. What this means is that I make sure to get everything done in those 10 hours a day that I'm given to get my work done. Being an hourly employee allows me to feel like my time is valued and compensated for fairly. Now, if there are scenarios where I can't get everything done, including my charting, my in-basket, and my patient encounters within the 40 hours, I can speak to my recruiter, which I call my physician liaison, and let her know to speak to the client to reduce those hours or the patient encounter numbers so that I can get everything done in my allotted hours weekly. And this is something that I think a lot of full-time attendings struggle with. I think a lot of people don't have the privilege to negotiate things like this, and additionally the privilege of having somebody negotiate for you. And locums has allowed me to not just negotiate things that I never thought I could, but also have somebody speak on my behalf if I don't want to have that difficult conversation. And that's been a huge blessing. So I get to do my work during my 40 hours that are allotted for the week. And if there are moments where we're going over because of all the tasks I'm assigned, I have the chance to negotiate that. My golden rule is don't bring work home, because I know that that's where a lot of the burnout comes from, and I want to make sure that my life at home is really for relaxing, and at work I'm very efficient. Many people have messaged me over the past few months about the job security as a locums. I think this comes from the idea that perhaps if your assignment ends, that there's no other option, or that you might not have a job, and that is not true. As physicians, we are very, very needed, especially when it comes to primary care, emergency medicine, but really all specialties, there's always a need. For example, I've been at my clinic extending for the past year and a half now almost. It's because there's a need. And if I didn't stay at this clinic, I know of many clinics in the area who had openings that I could have transferred to. But the coolest part that I do want to bring up is that you have to be adaptable when it comes to your job search. You know, be willing to travel if you need it, be willing to drive a little bit more if needed. But that's the beauty of it. I think working in different work settings is a huge growth, is a part of the growth that comes as a locums doctor. And I encourage people to try different settings. If it wasn't for me getting super attached to my patients at this clinic, I would have definitely tried a different setting, and that is my goal moving forward. And I have mentors. I wanted to kind of like share another really important aspect, which I kind of touched on earlier, which is mentorship. As a locums physician, I hope to be a mentor for all of you, but additionally, I come from the backs of mentors, not just the one that I met, I just spoke about earlier at my current assignments, but others that I've met through training who showed me the path of locums. And I know a specific mentor of mine who's been doing this for like 12 years, and she's been in the same city for the past 12 years, and she's been able to find opportunities in the city locally. And so that is a great example of someone who has not just done locums, but done it her way. She didn't have to leave her family, she didn't have to leave her normalcy of her comfort, her home, and she has had a job for the past 12 years. And that's something I look forward to as well. I will be traveling and starting in a new city coming up, so stay tuned for that. More on that on my page. But when I do transition, I hope to try not just obviously a new location, but a new work setting. So I'm looking into urgent care, I'm looking into taking call at the hospital, if that is something that I want to do. And that's the beauty of locums, that there's so many opportunities. It's a different way to practice medicine. No matter what your specialty, there is something for everyone. That's one of my favorite things about being a locums doctor. And if there's something that you take away from this video, is don't be afraid to think outside the box. Doing locums work has allowed me to feel valued as a physician. It's let me see what I can do with my education and training. And it's allowed me to connect with so many awesome people. This doesn't just include the staff that I've worked with at the clinic and the different backgrounds and perspectives they bring, but also my locums liaison, who has been with me from the start, from the job search to the licensing part, to asking her all the questions that I had as a new locums doctor. I mean, she was a big part of why I feel so comfortable. So I'm so grateful for this experience. I didn't know this existed. I didn't know that there were so many opportunities for physicians. I really thought that my life would be this very drawn out map, and I really had it all down. I thought this is what I was gonna do, and I really didn't think that my life would look like this. But I'm so grateful that I chose the path that most people didn't choose at the time. I was the only person in my graduating class to do locums work, and people were looking at me thinking, what is she doing? But I'm so glad that I stuck to my guts, and I'm glad that I chose a life of work-life balance. I chose a life where I felt valued, and I chose a life where I could do what I love, but also feel like I was being fairly compensated. And one of the best things I think locums work has taught me is how to negotiate as a physician. Believe it or not, this is something that I don't think is taught enough in medical training. We're not taught to fight for our worth or know our worth. And when I came into this, thanks to my mentors, thanks to other locums doctors who are working, for being open and transparent about how they got their job and the process and the negotiations, but all these things I learned in a better way because of locums, and I'm so grateful for that. And as a family physician, I can happily say that I love my job. I've loved the opportunities I've had because of it. I've learned so much because of it, and I've learned so much because of the mentors and people I've met through my job. I've learned so much from the locums doctor I met at my job who had way more experience than me, and locums has allowed me to connect with other doctors who are like-minded, and I'm so grateful for that experience. So if you have any questions, please message me on my socials, leave a comment below, and I will try to answer them. But stick around as I post more locums content and get more in depth with some of the things that I talked about in this video. And if you're here on Locumstory, thank you for being here. Locumstory has been a valuable asset to me and so many others who are passionate about locums work, and it's a great place to start and great place to be. So if you're here, welcome. I hope that you've enjoyed the content I'm putting out. I hope that this video was helpful, and I will see you soon. Bye.